Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Pediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who was kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
What's your name? Ben.
Ben.
Ben. All right,
Benjamin,
Ben.
if you're-
Benjamin.
Do you know what I fancy? I fancy you.
What time do you finish then?
Sorry?
What time do you finish?
Oh, midnight. Just
Oh.
begun. Just begun. And you?
Oh, 7:30 we go home.
Oh,
we start,
really?
we do 7 to 7:30.
I want to know if he's married now.
Are you married?
No, I'm not married.
No.
Julie and Jane?
Take care. See you soon.
you.
Bye.
Overseeing resus today is consultant Neil.
I relish that feeling of going from being calm to utter madness. Okay. In here, guys. That kind of adrenaline rush. That's one of the reasons I chose to work in emergency medicine. Okay, guys, this is the handover. I don't see it as a stress. I see it as a perk. Okay, so where's you going to put that one?
I can go in 5.
In 4.
4, sorry, yeah.
And then the COPD? Sometimes you don't get your break, because sometimes it is that busy. You do sacrifice a lot to do the job, particularly time with your family, my partner, parents, daughter. But actually, the greater good is that you're helping people that need your skills and expertise.
St George's A&E. Yeah. Sorry, say that again? Okay. Peds priority, 10-year-old playing football, twisted her ankle, very fractured femur. Pediatric priority call, 15 minutes. A 10-year-old playing football twisted her leg and they think she's got fractured femur.
That would be one hell of a twist.
A 10-year-old girl is being rushed to St George's after an accident playing football. After twisting her leg during a tackle, Paramedics are concerned that the impact may have broken her femur.
The femur is the bone in your thigh. It's quite a big, thick bone. So in order to break it, you've got to have some force.
Sorry, yeah, this is a trauma coming in.
You can lose a reasonable amount of blood from the breaking the bone. And the patients are usually in excruciating pain.
The girl's mother travelled with her in the ambulance.
I was in the kitchen with my mum and she went outside to play, and about 5 minutes later a little boy knocked on the door. I could hear the screams from inside the house, and the neighbours said as well that they could just hear this screaming. I panicked and just called the ambulance straight away. As I walked towards her, I could just see, like, the leg just looked completely deformed, and it was in a really unusual position as well.
This is Ashley. She's 10 years old. Playing football this evening, went to kick the ball, fell over the ball, but as she landed, her left leg basically twisted awkwardly. Had instant pain, left upper leg, femur area. There was significant deformity to the femur.
Okay.
It was good, you know, 10 centimetres shorter when we moved her. She's had 3 milligrams of IM morphine, 1 gram of oral paracetamol.
Okay. Sorry, Ashley. You know, when you break a bone, it can break into several bits, and it can injure the surrounding tissues, the muscles, the nerves, blood vessels, and it can start to cause problems.
You'll be fine, all right? But if you feel uncomfortable at all, tell us now.
Doctors need to X-ray Ashley immediately to assess the extent of the damage to the bone and surrounding tissue.
You automatically think, are they going to need an operation? Will the bone heal properly? How is it going to affect them when they're older? You automatically think the worst.
Ten-year-old Ashley arrived at St George's after injuring her leg playing football. She's been brought to X-ray to find out whether or not she's broken a bone.
My heart just broke for her because I just thought that she must have been in so much pain. I think it's just, that's part of being a mum. Since she was born, she's always been very clumsy. I've always tried to wrap her in bubble wrap, but it hasn't helped. When she was really young, she managed to open the stair gate and she fell down the stairs. She climbed out of the high chair and cut her head open and it had to be glued. She wants everybody to be happy and play together. I had Dolly quite young. Her dad, he was a couple of years older than me. We were all at school together, but he was in my sister's year. And then used to hang around with each other, and it just happened from there, really. It was just before I was 18, I had her. So it was all, I think it was quite difficult for everybody, really, at that age. The day that she was born, it just changed everything. Everybody was just so happy. My mum walked in and she just thought she was absolutely beautiful, and she just looked at her and said, "Oh, she's a little dolly." And that's all she's known as now.
I can wait my own. I've got my iPad.
I know you do,
I can play Scrabble.
Your first day, having just arrived, I'm not going to leave you on your own.
Watch that. This one.
No, just
do this one.
If you're happy and you know it's happy, feel happy and you know clap your hands. If you're happy and you know that you will always stories. If you're happy and you know clap your hands.
Well done.
3-year-old Lola suffers from febrile convulsions, a condition that causes her to fit intermittently. She's come to A&E with her dad Quinn after having a seizure earlier today.
We're going to put the water in the fire, okay?
Oh, brilliant. I love this game. I was in my early 30s when I became a dad, when Lola arrived. I went from 0 to 3 kids in a short span of 14 months. We were keen to find out as soon as we could, both of us really, so that we could start planning and, you know, painting rooms and buying the right colour clothes. So yeah, we did find out at 20 weeks, at the 20-week scan. Since we're in the hospital, let's play with this one because it's all about hospitals. The sort of traditional South African man is this firstborn son thing that some guys carry with them. I had none of that. I was absolutely delighted when I found out it was going to be a girl. She's full of energy. You know, the only time she ever really hurts her brothers is from over-affection. Do you know any songs about bees? Lola and I enjoy a good dance or a good sing-song together. Sometimes I'll pull the guitar out and we'll make up songs. Do you know any songs about butterflies?
Fly, 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 la, fly, la, fly.
She's a great little songwriter, actually. Are you feeling tired? I'm feeling tired. I think I want to have a little sleep.
Come sleep with me. Sleep with me.
Parenthood isn't what I imagined it would be. Thank you, Lola. I guess the reality is more of a challenge, but it's a glorious challenge. It's the systematic sort of handing over of yourself and your own priorities and putting someone else right in the center of your life. Oh, Lola, that's great. It's fantastic. But in every possible way, it's much better than what I imagined. Oh, Lola, this is really special.
Hello, A&E, can I help?
Blew into my eyeball.
No.
Huh? Yeah. Oh.
You touch your ear.
You did touch my ear.
Okay, Clarence?
That's me.
Yeah, would you like to come with me? Do you want me to carry that for you? Would that be
Yes, please, if you would.
Oh,
so I had to
okay.
Retired nurse Clarine has come to A&E with pain in her right foot. 2 months ago, she had surgery to remove a bunion in the same place.
Follow me.
Hello.
Hello, my dear.
How are you? Mrs.
Reasonably fine, thank you.
Miss, OK. My name's Craig. I'm one of the nurse practitioners. I'm going to look after you. And this is Beth Ann, who's one of the student nurses who's sitting in with me.
Nice to have you.
Yeah, good.
Is this your practical experience, or you have to go back to college?
This is my final placement now, so I qualify in the summer.
Oh, good for you. I'd never forget, in my time, you couldn't wear wedding rings. You had to strap it over around your neck.
Oh, really?
And that engagement ring there I had on a chain around my neck. Went to the toilet one day, and as I stood up, I thought it was sitting right on the crotch of my panty.
Oh.
The chain came undone. Honest.
You nearly lost it.
Yeah, I did.
Oh. So what's happened?
I had surgery on that right bunion.
Right. When did this happen?
On the 27th of April.
OK.
And the big toe. It's very, very uncomfortable at the moment.
Is it? Shall we take this off then?
Yes, please.
All right, let me just go and get the saw. I won't be a second.
I had a pair of clippers at home, but they were basically for taking off bandages.
Oh, yeah.
If they're a little bit bigger, it would have been off at home, I tell you.
Oh, you weren't joking.
No, I'm not joking.
It was...
My saw. Now, you know that this thing doesn't cut skin.
Doesn't it?
No, no, no.
Why not?
So, although it's a saw, well, we don't want it cutting your skin.
That's a clever one, then.
It makes a noise, but if I hold it on my skin, it won't cut. Okay. Is it tickling? Sorry. You know it's going to smell a bit.
Is it?
Yeah.
What of? Dead skin?
You'll have to put a bit of fragrance in it.
That put... Nearly dead.
Dead?
Because it hasn't moved for quite so long, you know what I mean? It doesn't feel as if it belongs to me.
Oh, really?
Not part of my body.
Okay. Lovely.
Yes, because there's no neck, you know.
So clumsy, Dolly. It's horrible. It was literally sticking out. I was like, oh my God, I'm going to lose my leg.
Doctors have received the results of 10-year-old Ashley's X-ray. She's been joined at St George's by her cousin and grandparents.
They said that it's measuring like 10 centimetres shorter than the other one now. That's what the paramedic said, yeah.
Because of the break.
Brilliant. Yes, please, yeah, thank you. Look at it, Mum. Have a look.
Yeah, go and have a look. Go on, Jan, you're
See this? So then when you get together, then it gets a little bit together.
Oh, my God.
Oh, God, I can't believe this at all. Yeah.
The scans reveal a clean break to the largest bone in her thigh, and doctors will need to quickly decide whether to operate or realign the bone by putting Ashley in traction.
I tell you what, Dole, no kidding, you've got a long road ahead of you.
No, I'm not playing football no more.
I think the hospitals are quite scary for her because she spent a lot of time with her dad in hospital. He was a car mechanic, so he had his own business. And he's just always really been into cars. And he got her, like, some little pink overalls when she was quite young as well, so he loved her being there. She just adored him and he adored her, and I think that made her feel special. And he would always take her out to nice places and they would enjoy their time together. And he had spent some time in St George's. He spent like a year at the hospital. But we didn't know that he was like palliative. We didn't know that he was dying of leukemia. We had a phone call to say that he possibly had a couple of hours to live, and she was at school at the time. She was 7. So I had to go and collect her from school, and I had to tell her that he was going to pass away. And she just like looked at me and said like that he can't leave her, and she was just crying. And I think it was just really difficult for her that he could just be taken from her like that. And then it was a week later that he passed away. I needed to put my emotions aside a bit, I think, because I think Dolly was the most important person. She was so young and she just needed everybody's support, and my main thing was just to make sure that she was okay, because when I told her, it just felt like I lost my child that day. And there was just no happiness in her eyes anymore.
Hello, A&E. Yeah, go ahead. Is it medical or trauma? Okay. Yeah. Yeah. Anterior lateral STEMI, yeah. Alrighty. Adult ground support, 10 minutes.
A 91-year-old woman is being rushed to St George's with severe chest pain.
When the red phone goes off and you hear a 91-year-old with severe chest pain coming in, my mind will automatically kind of think life-threatening. The problem is, chest pain can be caused by so many different things, not just to the heart. You've got, problems with the lungs, it can be something in the tummy. Chest pain is such a common symptom, and it can be something very benign to something extremely significant.
The woman's niece, Anne, travelled with her in the ambulance.
We were sitting in her sitting room, and we were both sewing. And we were talking, and she suddenly went quiet. I asked her a question, didn't get an answer, and I looked at her, and she was sitting there just holding her chest.
And take your shoes off, all right? I'll pop them over there.
She likes to be known as Betty. She's 91 years old.
Okay.
Today at 17:30, she was sitting in a chair, having a chat with her niece, and sudden onset central chest pain.
Yep.
We have given her aspirin, GTN 2 sprays.
Okay.
Morphine 5 milligrams.
Okay.
Cool.
Yeah. Thanks very much for all you've done for me.
No problem. You take care. All the best.
Yeah. Come again next time.
Betty, my name's Neil. I'm one of the consultants.
Oh.
Hello.
Hello.
Have you ever had this type of chest pain before?
No.
OK. Just going to examine your heart. Is that all right?
Can you do what?
Just going to examine your heart. Is that OK?
Oh, any old thing. One more.
We're just going to do some blood tests. All right.
Doctors need to test Betty's blood immediately to look for a protein that will confirm that she's having a heart attack.
Right, let's get this
Betty,
dripping.
I'm going to go get... I'll put a needle in your arm.
Another one?
Yeah, I like doing that.
Oh,
we love bloods here, that's the thing.
Doctors are awaiting the results of 91-year-old Betty's blood test. They're keen to find out whether anything in her medical history will help them determine the cause of her chest pain.
So, have you ever smoked? Do you smoke? Ever smoke? OK. And have you been feeling more short of breath recently?
No. I'm not feeling anything particular. I mean, I'm getting a bit sort of dicky on my feet. And,
yeah.
You know.
Do you live on your own?
Yes.
OK. And do you have any carers that come in to help you?
Normally, I look after myself quite happily.
Betty's niece, Anne, has been waiting to see her in resus.
Oh, you're back. You're getting a chair sitter.
Have you got a chair sitter? Yes.
All the junk in the house.
Got all your clothes and your handbag.
I probably just well have that.
Yes.
That's a good idea.
Betty lived in London. We moved up to Cumbria in the early 60s. But every year we would go down to spend our holidays sailing on the Solent, and we would call in at my grandparents'. We often saw Betty and any of the others then.
How many more things are going to...
Just some water.
I lived to 91, that's what I'll be like.
Yeah.
I saw more of her once I'd grown up because I went down to work in London. She was always interested in us. That was the best bit. She was always interested in what we were doing and where we were doing it. Great fun. She was just fun to be with.
Just asking your date of birth, Betty.
03.
0424.
Brilliant, thank you. Yeah, 3424. Nice, easy one.
Nice, easy one, yeah.
Betty and her 3 younger brothers were brought up by a nanny and all went to boarding school because my grandfather was a solicitor. She was a daddy's girl. She adored her father.
Do I have to keep this thing on?
Because they want to know what your heart's doing. They're keeping a check on your pulse.
Nobody told her when she went to boarding school that it was all girls. She said it was the best surprise of my entire life. No boys. Boarding school is probably the best training for the services you could possibly have. Because, of course, when she came out of school, it was wartime. And she was straight into joining up. She joined the Wrens. And once she was in the Wrens, that was it. She had to stay there till the end of the war.
You are talking to an ex-nurse here.
Oh, really? No, I'm not a fully trained one. I did about 1.5 years when I started, and I got food poisoning during the war. I got food poisoning, and they wouldn't let me go home, so I walked out.
She went up to the Orkneys and was a telegraph operator, translating from Morse to English and writing it down as it was coming in, and doing the same again as it went out again, to submarines and ships and everything out in the North Sea and the Atlantic, the North Atlantic convoys. After that, it was a case of she did what she really, really wanted to do, which was to travel.
It's definitely, the pain is definitely going off a bit.
Yes. We had a fair chunk of morphine through into you in the ambulance, which will have helped. Yes.
Although doctors have been able to manage Betty's chest pain with medication, they're still waiting for test results to determine the cause.
Ever heard such a palaver?
I don't want them, I can't eat.
They dissolve in your mouth. They're like the easiest thing you can eat. Next to soup, this is the next best thing.
Plonk it in there for me.
Bloody hell, that's cold. Have you got any warm water? It's cold.
Not that cold, is it?
That's cold. I like comfort.
Retired nurse Clarine has come to A&E with pain in her foot after having a bunion removed 2 months ago. Emergency nurse practitioner Craig has decided to rebandage the wound.
Does that feel good?
It's living again. I'm going to put some olive oil on that.
Good quality one, I hope.
Oh, yeah. Makes the dead skin separate quickly. Got a new foot?
With a bow.
Oh, lovely.
OK, hopefully that feels better.
Well, thank you very much.
And any problems, come back and see us.
You take care and all the best.
Thank you very much.
Thanks ever so much.
It's nice to meet you.
Bye-bye.
Take care.
You take
All
care.
right,
Thanks.
bye-bye. See you later.
Bye.
It's a lovely day.
It was quite nice. When I get home, I think I'm going to have a glass of wine with lunch to celebrate. The waiting time is always the worst.
OK, I'll do it like this. OK.
Casey, do you want anything more to eat? Are you OK?
No. I'm okay.
You're OK? You're not OK?
I want to see.
Don't eat them all at once.
Can you please this?
Should we play I Spy?
Yes. I spy with my little boy something together with
Lola. Is that you? So that's me.
3-year-old Lola has come to A&E with her dad Quinn following a seizure at home.
This way, puppy.
After being diagnosed with febrile convulsions a year ago, her dad is worried that her recent fitting may be the result of another underlying concern.
My name's Peter. I'm one of the doctors.
So hi, Peter.
Hello. What's brought you to see me today?
I'm Daddy too.
Oh.
And her name is Quinn.
That's my name.
And his name is Quinn.
Yes, and Mummy's name is Melanie.
Oh, wow. Can I ask Daddy some questions? Is that okay?
Yeah.
Thank you. So what happened
She
today?
had febrile convulsions. She's had, this is the 7th.
In sort of what time span are we talking? When did they first start?
Last October.
All right.
The first couple of times were a lot more severe, violent convulsions, eyes rolling back, stopped breathing.
And was she sort of shaking her arms and legs?
Yes. One was here, and they had to sort of take her to resus, and
Okay.
she stopped breathing for a few minutes, and they cut her clothes off, and that was the worst one.
And in terms of her behaviour normally, I mean, she was sort of hit all of her milestones on time, walking, talking all at the right times?
Yeah, she started walking a little bit late.
Okay. Talking, you feel that was all on time?
Oh, yes, she has absolutely no problem with talking.
Sure. Can we pop you on the couch so I can have a little feel of your tummy?
Yeah.
Oh, fab. And we'll lay you down nice and flat. Can I have a little feel of your tummy?
Yeah.
Are you ticklish?
Yeah.
Are you sure? Okay. Can you sit up for me? And I'm going to have a little look in your ears.
Oh, hello, what is he going to find in your ears? Since October of last year, she's had 7 of these episodes. These febrile convulsions.
I'm just going to come around the other side and have a look in the other one.
She was just sleeping in my arms. And I felt my lap go warm and wet. She wet herself, at which point I obviously took notice and her eyes started to roll back and she stopped breathing, and it's just awful. Naturally, when you see this sort of thing, you go through all the worst case scenarios, as we do. My wife's brother had a tumour, and the sort of climax of it was a fit. He'd had a major seizure.
Can you close your eyes nice and tight for me?
We're still trying to get to the bottom, really, of what it is that she's going through, whether it's just febrile convulsions or whether perhaps it could be epilepsy or, you know, God forbid, something more sinister.
Say, ah. And again.
You do sometimes think, why does she have to go through this? You're thinking, gosh, what if this happens again? What if it happens and we're not with her? In that moment, there's nothing I can do. I think that's the scary thing. Wow, I wasn't expecting this. So, yeah, the man in me says, I'm out of control. That's a very uncomfortable place to be.
I just want to have a look at her old letters and bits and pieces, and I'll come back and have a chat with you again.
Thank you so much.
That's all right.
It's been just over 90 minutes since 10-year-old Ashley arrived at St George's after breaking her leg. Orthopedic doctors have arrived in Pediatrics to discuss how they intend to treat the split femur.
Hello, hi, I'm Michelle. Hi, nice to meet you.
It's quite a severe break that she's got, so usually it will involve us doing a small operation for it.
Okay, yeah.
It'll involve us putting 2 small sort of what we call nails, so little wires which go through from near the knee and go up all towards the hip. And 2 of those are put in just to stabilise the bone and let it all heal up.
Yeah, okay. Thank you very much. Thanks.
Do this no more.
I know.
Why does it always happen to me?
Because you're so clumsy, that's why. I felt like she definitely had to grow up quickly with everything that had happened. But on the other hand, she's still very babyish in the things that she does. And I really like to see that, her playing with the little dollies still and ponies and things. And it's just nice to see her getting back to normal now. And just being able to kind of have that childhood back again, really. Gulliver can wipe your lashes off. One of the most important things for her was to take her teddy bear with her that her dad had taken around all of the hospitals with him. And I think that she just felt that he was there then. When she was growing up, everybody would say that she was just like him and looked like him, and I could never see it. But I think it was the day that I had to tell her that he was very unwell, that I just looked at her and I could just see what everybody had been saying, and definitely since he's been gone, it's just like she's completely got his soul, and it's just like looking at him. Good girl, keep breathing.
Have you ever stayed in hospital before overnight? You don't think so? It's the first time for everything, isn't there?
It's definitely made us realise how precious life is now, and that we just try to enjoy as much time as we can together.
Ashley will be taken to an orthopedic ward before having an operation to realign the pieces of bone in her thigh. It's been just over 15 minutes since 91-year-old Betty arrived at St George's with her niece, Anne.
Elizabeth?
Yeah.
Hello, Elizabeth. My name's Chris. I'm
Yes,
one of the
try
nurses.
Betty.
Betty, I do beg
Yeah.
your pardon. My name's Chris. I'm one of the nurses here. We have some tablets for you. I'm afraid we have quite a few. Would you be able to take these for us?
I expect so. That's...
Excellent.
I've got to swallow the whole lot.
I'm afraid so.
She absolutely loved travelling, and she would maybe work 2 or 3 years, usually in London, places like solicitors. And then she'd drop the job, because she'd been saving like the clappers, and go off travelling for a year.
I don't think I'd get them all down at once. I don't think I've ever been asked to swallow 8 tablets at once in my life.
She visited South Africa several times. She went to India. She had friends and family in Delhi. She went to Singapore, Hong Kong. Certainly Australia and New Zealand and Canada were very big favourite places to go. She buzzed around and did her own thing. Well, I'm glad I was here.
Yes, I'm glad you were here too, I must say. Coping with all this by myself would have been difficult. I mean, not impossible, but difficult.
Difficult, yes. I think she was ahead of her time, certainly. I mean, don't forget, when I was little, getting married and having children was still the sort of thing you did. Betty showed that it didn't have to be like that. And yes, she was probably trailblazing in a small way.
Doctors have received the results of Betty's heart reading.
When you're telling someone such big news, one of the key things that I try and do is to not kind of beat around the bush and tell them.
Oh, sorry, Betty.
Betty, the tracing of your heart shows that you're having a heart attack.
Well, I thought I was, yeah.
Yeah, quite a large one, it looks like.
Oh,
okay.
that's bad.
It can be, but you're in the right place.
Oh, good.
Which is good.
Glad about that, yeah.
So the heart specialist, the cardiologist, are going to come down and see you.
Oh,
okay.
Oh, I like it.
Yes, again, that looks very different.
Yeah, so print that.
Done another one.
Perfect.
God knows what they're all doing. These are what you might call the rather high-powered medical whatnot.
Hello, Betty.
Hello.
Nice to meet you. I'm Dr. Shag. I'm one of the heart doctors. So heart attack is caused by a blocked artery, blocking the blood supply to the heart. And the treatment for that is to open the artery up. OK, we'll take you up to the lab now. The doctors are waiting for you there, Betty.
Oh.
And come up with her. Wait. She's not going to come back.
Betty now faces life-saving surgery, where doctors will attempt to unblock the arteries in her heart.
It's all right, I've got it on stage.
It's all very exciting, the whole thing. Charging her up. Hospital, nothing but a pair of pants and a bra on, I ask you.
Yeah, round to your left.
you singing a song?
You twinkle, twinkle.
Yes, please.
Twinkle, twinkle, little star, how I wonder what you are.
3-year-old Lola suffers from febrile convulsions. Her and her dad Quinn are awaiting the results of a test to see if her most recent fit was caused by something else.
Lola, you've been very brave today. So good. High five. It's been such an adventure today. Yeah. You saw the big doctor.
So, 3-year-old, noted to have a fever today. He's had a subsequent seizure. I was going to see if I could expedite her pediatric appointment.
Yes.
There's a strong family history of brain tumours, and that's what their big concern is, essentially.
Yeah, I think she just needs to go to the clinic early and maybe penicillin for her throat.
Yeah, for the throat. That's what I was thinking.
Lola's tests haven't revealed anything significant that could have caused her latest fit, but doctors have decided to refer her for a specialist appointment.
We feel that the fever's coming from the throat. When I have a look back, it's quite red. On the left tonsil, there looks like there's some exudate there as well, saying she's got a sore throat.
Yeah.
Imagine potentially in the sort of next 24 hours, it might be start getting sore.
Okay.
But we'll give her some antibiotics for the throat, because I think that's what's provoking the fever.
Fantastic. Thank you so much.
That's all right.
Hello. So they say the back of her throat is inflamed, and I think that's probably what brought on the high temperature, which then brought on the convulsion.
Daddy,
She wants to talk to you. You want to talk to her?
Can I talk to her?
1 sec.
Hello. I'm in a hospital. Yes, I'm coming soon. Bye.
Okay, babe. So I'll.
Okay.
Should we take a bus? Her and my relationship, it is different to my relationship with the boys. Lola loves her fairy tale books, and so she's getting to grips with the prince-princess scenario. So just the other day, she bounded into the room, jumped into my lap, grabbed me at both cheeks and said, "Daddy, true love's kiss," and plonked her face against mine for the longest time. And certainly at the moment, I assume that role of prince in her life. As long as I possibly can, I want to assume that role.
Follow me. Daddy, should we get an ice cream?
We're gonna get an ice cream.
Okay.
As a dad, I spend my life arranging the furniture around her life to ensure that all the corners aren't sharp and that the landings will be soft. That's going to be the rest of my story with bouncy little Lola, arranging the proverbial furniture.
You can hold my hand if you want.
Thank you.
She'd been really excited because she was bridesmaid for my sister's wedding. It was like a week until the wedding, so she had the dress and everything. And I think her biggest worry was that she thought she'd be in a cast and wouldn't be able to wear her new shoes. But yeah, she looked beautiful and it all went to plan in the end.
In the mornings, I would take my cup of coffee and go and sit, and she'd have her breakfast in bed, and I'd sit on the stool and we'd talk for an hour or so, sometimes more. She'd sit there and say, "I never thought I'd reach 91. She had a couple of very bad days. Friday in particular was not good. Then she died on that Wednesday afternoon. We gave her a darn good send-off. We went to Wimbledon crematorium. Even one of her New Zealand friends got the news and come over. And we told everybody to wear colour, because she loved colour. And then we went and had food and things in the hall where we'd had our 90th birthday party as well. Yes, we gave her a jolly good send-off.
Are you ready to face the day?
Adult male, trauma call, 8 minutes.
Motorcyclist versus car. They said the dent in the roof is his face.
He slide.
T-bone into the side of the car, turning right onto him.
Can you tell me what year we're in, Robert? What year are we in now? What year is it?
I think we need to slow down a bit before it's too late.